Obesity is defined as an excessive or abnormal fat accumulation that often associated with health condition. Obesity is a complex disorder due to imbalance in which energy intake exceeds energy expenditure over a prolonged period. Due to this imbalance, we can indicate an increase in intake of energy-dense food and decrease in physical activity. Obesity is measured by a type of calculation which is known as body mass index or BMI. BMI is a person's body weight divided by the square of their height. The weight usually be calculated in kilogram, while the height usually be calculated in meters. For underweight, the calculation is less than 18.5. For normal, the calculation is in the range of 18.5 to 24.9. Overweight, the calculation is in the range of 25 to 29.9. For obese, the calculation is in the range of 30 to 34.9. Extremely obese, the calculation is more than 35. First one is genetic. Gene also may contribute to a person's susceptibility to weight gain. A disease that is known as Prader-Willi syndrome is a rare genetic condition that affects the children's metabolism. Although it is rare, a life-threatening complication such as respiratory illnesses and cardiovascular problems can occur. Second is emotional factors. When upset or stressed, some people tend to eat more. Emotional eating is one of behavioral mechanisms that can cause overweight.
Early months, mother may lose a little weight, later make up 25 to 30 pounds of weight for fetus growth and supply energy during labor. 25% to 40% of women gain weight more than they should during pregnancy. What are the effects of obesity? The effects include risk of heart attack, depression, sleep apnea, skin rashes, joint pain, infertility, kidney failure, risk of stroke, weakened muscle and bone, GERD, cancer, liver issue, and the last one is gallbladder issue. First is BMI value. The measurements of height and weight is taken. The height and weight is then calculated using the BMI formula. If the calculation exceeds the measurement that were defined by World Health Organization, the person is considered as obese.
Second is waist-hip ratio. The measurement of hip and waist is taken. By using the same unit, the waist circumference is divided by the hip circumference. The waist-hip ratio value that indicates obesity is more than 1.0 for males and more than 0.85 for females. Third is waist circumference. The waist circumference is measured. The value that indicates obesity is higher than 94 cm for males and higher than 80 cm for females. As a physiotherapy, we need to plan an exercise for the patient. We can advise the patient to go for a walking, cycling, modified squats, yoga, jumping rope, dancing, modified push-up, and jumping jack.
Now we are moving to non-physiotherapy treatment. The operative include liposuction. So what is liposuction? Liposuction use suction to remove fat from a specific area of the body, such as stomach, hips, thigh, buttocks, arms, and neck.
The dietitian can advise the patient to take a daily healthy diet. The patient should prescribe enough fruits, vegetables, and grains. The patient should take less or total cut in meat and lower fat dairy products. Next, the intake of food with high fat also need to be limited.
Early months, mother may lose a little weight, later make up 25 to 30 pounds of weight for fetus growth and supply energy during labor. 25% to 40% of women gain weight more than they should during pregnancy. The weight are distributed as follows, with fetus 7.5 pounds, breast 1.5 pounds, placenta 1 pounds, amniotic fluid 2 pounds, uterus 2 pounds, energy store 6 pounds, extra body fluid 4 pounds, and blood volume 2.5 pounds. So what are the effects of obesity on pregnancy? The phases can be divided into 3 phases. First, effect on antepartum. Second, effect on intrapartum. And last one is effect on postpartum. The first one is effect on antepartum, which is during pregnancy. Obesity can increase the risk of miscarriage due to various factors. It can impact hormone levels, disrupt ovulation, and cause issue with the uterine environment, making it more challenging for a pregnancy to implant and develop properly. Not only that, obesity can also affect the placenta, leading to complications that impact the supply of nutrients and oxygen to the baby, potentially resulting in stillbirth. Next, obesity can also cause preeclampsia and also type 2 diabetes. The effect on antepartum also include congenital anomalies such as spina bifida and heart disease. The mother also suffer from cardiac dysfunction. The second effect is effect on intrapartum, which is during labor and delivery. Obesity can also increase the likelihood of needing induction of labor. This might be due to various factors, for example, higher risk of prolonged pregnancy or difficulty during labor, which could prompt healthcare provider to induce labor to avoid potential complication of the mother. Other than the induction of labor, the healthcare provider can also advise the mother to undergo caesar delivery. Not only that, obesity can also increase the risk of venous thrombosis, which is formation of blood clot in pregnant women. Obesity might exacerbate the symptom of endometriosis, a condition where tissues similar to the lining of the uterus grow outside the uterus. The last effect on intrapartum include vaginal birth after cesarean. Obesity doesn't directly prevent vaginal birth after cesarean, but it might increase the complexity and risk associated with it. Now we are moving to the effect on postpartum, which is after pregnancy. The first effect is postpartum weight retention. Obesity people itself often involve metabolic changes and alteration in hormonal regulation, which can make it more challenging to lose weight after childbirth. Not only that, obesity can also increase the risk of postpartum infection due to several factors associated with conditions like diabetes or high blood pressure, which can weaken the immune system, making it harder to fight off infection. Next, obesity can also cause postpartum depression. The hormonal changes during and after pregnancy, combined with the stress of childbirth and caring for a newborn, can increase the risk of postpartum depression. The effect on postpartum also include early termination of breastfeeding. Women with obesity may face physical difficulties such as issue with positioning the baby comfortably for breastfeeding due to larger breast size or challenge in finding comfortable position to nurse. The last effect on postpartum include postpartum anemia. In obese individuals, there might be an increased risk of complication during childbirth, such as hemorrhage, which can lead to significant blood loss and subsequent anemia. In this section, we are going to recommend some exercise for pregnancy among obesity people. The benefit of exercise include to maintain weight, to reduce chances of developmental issue, and to reduce aches and pain. First, healthy diet. Achieving and maintaining a healthy weight also include a healthy eating style. After achieving a good weight, we need to maintain it so that we are far from being obese.
A healthy diet can be obtained by emphasize fruits and vegetables. Next, take whole grains. Next, the sugar and sodium intake need to be reduced. Next, drink enough plain water. Next, take less low-fat dairy products. Next, less intake of comfort food such as fast food. Not only by eating, we also need to exercise to maintain the weight. The type of exercise that we can perform is intense exercise. 75 minutes of vigorous intense aerobic activity each week. This includes aerobic dance, jogging, and competitive sports.